to the member for Dunkley.
Thank you, Deputy Speaker, and I thank my colleague for speaking earlier than he perhaps thought he might on this bill, because I was a little bit late into the chamber. I rise to speak on this bill, and as speakers before me have said, Labor supports this bill, and there is a second reading amendment which talks about GPs. And I wanted to take this opportunity to speak on this legislation because there are a number of issues that relate to GPs and health services in my electorate of Dunkley that I am incredibly eager for the government to take up, either to support or fix. The first one, and it relates to something that my colleague was speaking about just before me, is lack of access to GPs, but in particular, this is an issue in outer suburban areas. My seat, Dunkley, is an outer suburban seat, and I've spoken before about the GP clinics that are just finding it impossible to get Australian-trained GPs to come and work at the clinics, and have been relying on GPs from other countries, and are now finding themselves in quite dire straits because they cannot keep GPs employed. And as I have raised with the Minister for Health before and spoken about in this chamber before, the main issues are that as an outer suburban area, we're not classified as a distribution priority area, that the removal of Medicare incentive payment 10981 causes financial difficulties and disincentives for doctors to stay in bulk billing clinics as opposed to going into private practice, and that clinics would like to see options for sponsoring doctors from overseas because they can't hire locally, and that's was more difficult before the pandemic and is even more difficult now. I appreciate that these are not simple issues to resolve, but in the end, the clinics that I'm talking about are in Carrum Downs and Frankston, and look after people who rely on bulk billing and look after some of the most socio-economically disadvantaged people in the broader Melbourne area. And we know that in the community of Frankston, a lot of the health measures, we just are so far below the rest of Melbourne, the rest of Victoria and the rest of the country in terms of life expectancy, the issues with alcohol and other drug addiction. Diabetes is a significant issue. You can go on and on and on. We need really good GP clinics that are bulk billed and good GPs. So it's an issue that I've been raising for way more than 12 months now, and I'll continue to raise it. It's an ongoing and serious issue in my community. The other issue that we have in my community that is not being addressed by the federal government, and charities, not-for-profit, has to step in to address, which has been raised with the Minister for Health because it's also operating in his electorate of Flinders, but I'm yet to see any government support for, is access for children from disadvantaged areas to paediatricians. There is a real problem with children from lower socio-economic areas getting in to see paediatricians, which I can't even believe I have to say that sentence out loud in the federal parliament. That just should not be the case. The Menzies organisation, with an amazing local man called Kevin Johnson, who is part of it, as a charity is providing paediatricians in schools. They are now servicing 22 schools in the broader Mornington Peninsula, including Frankston area, with paediatricians. From the 27th of January of this year until the 1st of April of this year alone, term one, there were 323 appointments, including 85 new patients, of children seeing paediatricians, often, particularly for those 85 new patients, for the first time ever. The first time ever seeing a paediatrician in their young lives. In my electorate, the Peds in Schools program, Paediatricians in Schools, is out of Mahogany Rise Primary School, which also services Alder Court, Seaford Park, Kananook and Monterey Secondary College, and out of Kooringal Primary School, which services Frankston East, Ballum Park, Kooringal Heights, Kingsley Park Primary Schools. This is a program that is providing essential care for children that need it now, and also that crucial preventative health care that not only enriches the lives of the children, but of course has so many benefits for the community and for the bottom line of health budgets. This is done by Menzies in conjunction with Peninsula Health through donations alone. As I said, is not supported by government funding. I'm hopeful, because I've lobbied for it, that when we have the opportunity to go through the detail of the measures in the health budget, that I will find some money in there for this essential and amazing program, but certainly it hasn't been announced. And my serious concern is that the Minister for Health, as I said, in whom his electorate this program operates in, hasn't seen fit to support it. So that's why I wanted to speak on this legislation. It's a terrific program, and I really want to urge the government to support basic health care for young children who otherwise wouldn't get it in my community and in the electorate of Flinders. Thank you. That's my contribution.
The question